About Nutella for the next 10 minutes because I can do that very easily. But what I'd really like to talk about is, I guess, the situation in Australia when it comes to social media and diabetes. So I guess I'm in a little bit of a unique situation because I work for Diabetes Australia, which is the support organisation for people living with diabetes. We're the peak consumer body. And I also have diabetes myself. I live with type 1 diabetes and have done so for the last 15 years. I'm also an e-patient. I am a diabetes patient advocate as well. So at times my real job doesn't sit too well, I guess, with the job that I do when I'm outside of work, and that is the blogging and the talking about real life with diabetes. So I'm calling it the Challenge of 4, but here we go. So I quite love this picture because it's trying to show you the size of Australia. A lot of people don't actually understand just how big Australia is. There aren't many of us. There are only 22 million of us, and we're living in a very huge, huge space. So given the fact that this is our size, and one whole state has actually been left off here, poor Tasmania, it kind of makes sense that we should be using communication tools that break down barriers and that can reach as many people as possible. We're not doing that at all, unfortunately. Right now, we actually can reach everybody, but it's not happening. What we're finding is actually that we're being blocked from a lot of avenues. And my job, I guess, is trying to reach people, and I find it very difficult to do that because while patients seem to be embracing the technology, we're being stopped by other avenues. So the patients don't need convincing. This picture is another situation. I often have interesting discussions with my parents as well when, my parents said, "So what are you doing tonight?" "I'm going out and meeting a bunch of people that I met on Twitter. I've got no idea who they are." And my mum on more than one occasion has said, "This could be the last time I'm speaking with you, I guess." But this was a night in Melbourne. It was a freezing cold night, and these people had all been quite active on Twitter in different tweet chats about diabetes, and we thought we would come together and talk about the possibility of starting an Australian-specific diabetes chat. So we got all together and we did just that. We know that social media provides, it augments what's already being done in traditional peer support and information provision. Face-to-face meetings are great, we know that, but this is reaching people that we couldn't otherwise reach. We also are working quite closely with industry, but there are real issues when it comes to working with pharma companies for us. There is so much confusion around the legislation. I don't understand why there is that confusion in Australia because to me it's quite clear. Pharma companies cannot speak about any medicines directly to people living with a health condition, to consumers. However, we can talk about devices, and yet there is a real reluctance for industry to be in any sort of conversation with people with diabetes. And this is ridiculous when you consider that devices are being developed that we are meant to be using to improve our lives every day. We're sort of shown the end result with no consultation in the development stages, and that makes it very difficult for us to be able to say, hey, I think this is actually the best way that I could be managing my diabetes. Thank you. There is absolutely no engagement or acknowledgement of patient blogs or of patients' opinions and of patient get-togethers, and I find this quite confusing. All communication is directly through health professionals, expecting the health professionals then to talk to the patient about it. And we know that that's not happening. But there are some really exciting signs, and I do want to talk a little bit about how the IBG Star blood glucose meter was launched in Australia, and it was the first time that a device company said, we're launching this and we're going straight to the consumer because we know that the consumer is the one who's excited about this, who's going to be talking about this. So hey, nice little free PR for us. And also, they're the ones who are using it, and they didn't go through healthcare professionals. The result of that in Australia is healthcare professionals hate this device. I don't know. And we've also been fortunate enough to have some really terrific international speakers who used to come all the way to Australia, which, believe me, having done this only 2 days ago, is so far away. They would come and they'd give 2 talks only to health professionals, and they wouldn't actually speak to the people with diabetes, but that is slowly but surely changing. And then we have our healthcare professionals, and I need to say this isn't about bashing doctors and it's not about bashing nurses as well, but there is a real reluctance when it comes to social media and to peer support and to patient engagement and the value of these sorts of activities from our health professionals. There is so much suspicion about what social media is all about. How can Twitter possibly be doing anything is what I constantly hear. Remember, I work for a diabetes organisation. I'm surrounded by health professionals who just look at me with a very puzzled look on their face when I talk to them about what happened at last night's tweet chat. And then the health organisations, and we are getting better, and I do say that, and I say that quite proudly as an employee of Diabetes Australia. We are embracing social media slowly but surely, and we are understanding how many people that it can reach. This year, for the first year, and gee, there are some people in my organisation who feel very progressive because we actually did a webinar. Now, I've been pushing for this for years, but there was this real nervousness about doing a webinar because what if people ask questions and, you know, there's not a health professional in the room to answer them? And so slowly but surely we are doing it. But the thing about health organisations is that we are the key because we can actually link all 4. We are respected by patients, we are respected by health professionals, and industry wants to talk to us. So what are the drivers here? Well, the patients are the drivers, and this is the thing. We are the early adopters of this technology. But where the issue is that health professionals will not listen to patients. They will not listen to patients saying, this is of value and I am getting something from this. And while in Australia we have only a couple, and I mean it when I say that I can count them on one hand, the number of health professionals who really are embracing this sort of technology and using these sort of platforms, then there aren't enough of them to be out there talking to other health professionals and explaining why this is of value. We know that, as I said, health organisations are the key. We know that industry can help us because they have the means to offer initiatives to bring people together. And we know, though, also that there needs to be a real change in the way that social media is being discussed. Patients know it works. We know it works. We talk about it every day. And it's more than just walking around with a big jar of Nutella, even though that is something really important. And it's not an either-or situation. Using newer technologies doesn't mean that we abandon everything that we already know works or doesn't work. It's a way of working it out and using it all together. Thank you.